pregnancy is an extremely important stage in the life of every mother, as the care taken during this period directly reaps good health for her and her child post-delivery. If you are among those who want to ensure the best for yourself and your baby during your pregnancy and lactation, then this episode of Health Point is for you. Calcium plays a crucial role in maintaining healthy blood circulation, supporting muscle function, and facilitating the transmission of nerve signals from the brain to various parts of the body. Ensuring an adequate calcium intake during pregnancy is crucial to support the musculoskeletal, nervous, and circulatory systems. Many women recover lost bone mass after pregnancy and breastfeeding, but it's still a good idea to stay ahead of the game and ramp up your calcium consumption during pregnancy. Today, we have with us Dr. Hrishikesh Pai, President of the Federation of Obstetric and Gynecological Societies of India, or commonly known as FOGSI. Let's know about calcium requirements during pregnancy and lactation in detail from Dr. Pai.
Dr. Pai, thank you so much for joining us once again. You said that pregnancy and lactation are times of high calcium requirement. Could you elaborate on why exactly this is said?
Calcium is a fundamental mineral during pregnancy and lactation because it plays a critical role in the development of the fetal skeleton and overall maternal health. The developing fetus requires about 30 grams of calcium by the end of gestation, with a significant 80% of this requirement accumulating during the third trimester when the fetal skeleton grows rapidly. To meet this demand, calcium transfer to the fetus averages around 50 milligrams per day during the second trimester and increases to 250 milligrams per day during the third trimester. During pregnancy, the woman's body has a remarkable way of compensating for the increased calcium demand. It physiologically adjusts by increasing calcium absorption in the intestines, reducing renal calcium loss, and even reabsorbing some calcium from the maternal skeleton.
Great insights, Dr. Pai. Finally, could you summarize the recommended calcium intake during pregnancy and lactation?
Of course. During pregnancy, a total of 1.2 grams of calcium is recommended. This not only takes care of the mother's calcium needs, but also account for the additional requirements during pregnancy. During lactation, it's advisable to continue with an intake of 1.2 grams per day. This is important because a lactating woman produces about 750 milliliters of milk daily, which represents approximately 280 milligrams of calcium.
Thank you. Now, let's see what our other doctors have to say about this.
The earliest changes in calcium metabolism during pregnancy is a decrease in the total serum calcium. Maternal skeleton returns to normal at the conclusion of breastfeeding if calcium intake is adequate. The maternal skeleton starts absorbing more calcium early and stores it in preparation for when the fetus will need it during the skeletal development in the third trimester. Calcium is essential during pregnancy and lactation.
Despite adequate or inadequate intake of calcium by the mother during lactation, the breast milk composition of calcium is never compromised. The baby will always get what it needs. If you take an average of about 1000 ml of breast milk per day, 850 to 1000 ml actually, it contains about 50% of proteins and 30% of calcium. This calcium has to necessarily come from the source from the mother, may it be from her dietary intake, may it be from her supplements, may it be from her reserve calcium from her bones.
During pregnancy and lactation, these functions become even more critical. Inadequate calcium intake during pregnancy can lead to detrimental consequences. Furthermore, insufficient calcium can impair fetal skeletal development and result in lower calcium concentrations in breast milk, affecting the infant's bone health. Calcium supplementation during pregnancy and lactation is often recommended to ensure both maternal and fetal well-being. That's all for now. See you on the next episode. And until then, don't forget to keep it healthy.